So the first question is, does the child need an operation or surgery? And yes, this is a great example of where surgery is really beneficial and absolutely necessary. And why is surgery necessary? Because the hernia can come out, and the hernia is often a loop of intestine that can stick through this defect in the abdominal wall, and it can get stuck. And when the hernia gets stuck, it swells up, or it can twist. And you can basically, we then call it incarcerated hernia.
Yeah,
and
those terms are incarceration or strangulation. Those are the terms you'll hear from surgeon, but all it means is stuff getting stuck or stuck not being able to go back in. Basically.
Absolutely.
That's for the parents to understand.
And the strangulation is when it loses its blood supply, and that can be very, very dangerous. And the children, when this happens, the hernia doesn't go away. The hernia comes out, gets stuck out. It's very sore. It can get red and inflamed. Your child can start vomiting. And that is a case where it becomes an emergency. I wouldn't wait around. I wouldn't think, I'll get to see the doctor in a couple of weeks. If that happens, you go to the hospital immediately, to the emergency room, and they will either push it back to get it reduced, or they'll take your child to the operating room. Now, if you came and saw me in the clinic because you had a hernia that came out and went away and came out, I would schedule you electively to have the hernia repaired. And the reason we repair it, because these hernias don't close on their own. Specifically, inguinal hernias will not close on their own. And the risk of it getting incarcerated can be significant. Now, if your child's in the operating room in the neonatal unit, for example, we can often fix it before the child goes home, and then you won't have to worry about it when you go home. Other surgeons will sometimes send the child home, wait for the child to grow, and then it's suitable for the family and suitable for the surgeon. An older child who has an inguinal hernia should be repaired on an elective schedule. Of course, with what I told you earlier, that if the hernia came out, got stuck, got strangulated, made the child sick, that's an emergency. But besides that, an elective operation is perfectly fine for these children, and they should come back at the right time when everything is set and have the inguinal hernia repaired.
So for those parents with kids with inguinal hernias, those hernias require operation. They're not going to go away. You need to seek and see a pediatric surgeon who then will fix those hernias at appropriate time given your child's condition, whether it's prematurity or full term, and they'll determine that. Compared to umbilical hernias, which we'll talk about. So a lot of parents would want to know, how do you fix those hernias? There is a new way of doing it, minimally invasive or laparoscopic, which is now the terminology everyone uses, with little small scars, which is an open operation. How do you determine and what do you, I know what I do in my practice, but maybe tell a little bit to the parents, how do you fix the hernias, whether it's the female, male, there are differences and whatnot?
So there's lots of ways of doing this, and all surgeons will do what they're most comfortable doing and what they do best. And I think that's the most important criteria. You're absolutely right, Dr. Petrosyan. The operations have evolved from an open operation, which was a very small scar, to a laparoscopic operation, which is 3 little holes. And time will tell what the better operation is, but we think right now for a young boy that a minimally invasive approach is probably the best, because the intervention is minimal as far as any injury to the blood vessels or the duct that goes to the testis. However, we don't know for sure whether that operation will have as good long-term effects as the open operation, which has a very low recurrence rate. Less than 1% of children who have an open inguinal hernia will have a recurrence of that inguinal hernia, which is 1 in 100. With the laparoscopic approach, the incidence is a little higher. It's been reported to be as high as 6 in 100 children, but it's probably around about 3 in 100 children who have it.
Recurrence meaning it's going to come back.
Yes, absolutely.
So if you're having, what Dr. Sandler is saying to those parents is, if you haven't had an operation the open way, there is less than 1%, less than 1 child out of the 100 will have recurrence, meaning it'll come back. And if you have laparoscopic, roughly close to 6%, or 6 out of 100 will come back. Hernia.
That is correct. And I think what the message should be is that both operations are very good. The surgeons will have their preference, and the surgeons will decide what they like most. But as long as they've been doing it and they do it well, I think you could have either operation.
Now, is there a difference between females and males? normally we tell parents the female groin operation is relatively easier in a way that there's not a lot of vital structures around the hernia itself.
Little girl hernias are much easier because you don't have vital structures like the duct and the blood vessels to the testis. The operation is really very similar. You're closing the same defect, but nothing of any consequence has gone through that defect or that remains there after the surgery. So the hernia goes through the defect, but there's no testis in a little girl that moves through the defect.
But we do have sometimes the bulge that parents complain in girls, and that's most likely either an intestine or an ovary that can migrate and get into that area and incarcerate or get stuck in there.
Absolutely.
That becomes an emergency.
Absolutely. So the ovary that gets stuck in the hernia sac or in the groin does become an emergency because that also can strangulate or twist or volvulize and lose its blood supply. So we need to preserve the ovary. Most of the time those ovaries are easily mobile and they're not that stuck. They're just located in that area, and then we have to push them back and fix the inguinal hernia just like we do.
The child has an operation, everything goes well. What are some of the most common, I should say, although rare, complications that can happen with the operations around the groin area, whether it's being female or male?
So this is obviously a very important question because parents are very concerned about the complications of surgery. I can reassure parents that this operation has a very, very low incidence of complications. And the complications that surgeons do try and prevent to the best of their ability is bleeding, as in any operation, infection, as in any operation. But when you're operating on the testis, it's also an injury to the vas, which is the duct that carries the semen from the testis later in life. And although this is reported, it is a very rare complication. The complication of not doing surgery is significantly higher than the complication of doing a surgery on your child. So my strong recommendation is that the parents should feel very comfortable and very reassured that it's a good operation with an extremely low complication rate.